Welcome back, everyone. In this part of the blood vessel topic, we're going to learn about the major pulmonary and systemic vessels. Now, you're going to see, particularly on the systemic side, that there are so many vessels, both on the arterial side and on the venous side. Now, we don't expect you to be able to name and identify all of them. We're going to just pick out some of them for you that we think are important for this level of the subject. And then as you move through your course, you'll start to learn about other ones. So in terms then of learning objectives for this part, it's to be able to identify the vessels through which blood travels within the pulmonary circuit, beginning from the right ventricle of the heart and ending at the left atrium, and then be able to identify and name the principal arteries of the systemic circulation. So just a little bit of a recap on the circulatory routes again. With the systemic circulation, of course, blood is going to flow from the left ventricle through blood vessels, as you can see here, to all parts of the body, except, of course, the gas exchange tissues of the lungs. And then, once that sort of capillary exchange has occurred in the capillary beds, that blood then is going to flow back to the right atrium. In terms then of the pulmonary circulation, this venous blood flows from the right atrium into the right ventricle and then up through that short pulmonary trunk, which is about 5 centimeters long, and then into the right and left pulmonary arteries, which then branch to form the lung arterioles and the capillaries. And it's in the capillary bed, in the lung tissue then, where gas exchange occurs. And of course, oxygen is going to enter the pulmonary capillaries and carbon dioxide is going to leave. That oxygenated blood then, of course, returns to the left side of the heart again via these pulmonary veins. Okay, so let's have a little bit of a closer look at the pulmonary circulation. As I mentioned to you, blood flows from the right side of the heart into the pulmonary trunk, and the pulmonary trunk branches to form the right and left pulmonary arteries. Okay, those arteries then take that blood towards the lungs, and they continue then to divide, eventually, becoming smaller and smaller arterioles, and of course then to the capillary beds that sort of wrap around the alveoli of the lungs. Oxygen enters the blood capillaries and carbon dioxide leaves. Now, not shown here are the lobar arteries, which we will talk about when we get to the respiratory system. And there are 3 lobar arteries that supply the right lung, and there are 2 lobar arteries that supply the left lung, and that's because the right lung has 3 lobes. The pulmonary veins, which you can see here, the 2 left pulmonary veins and 2 right pulmonary veins, then return that oxygenated blood back to the left atrium. So everybody, I've just put a little note here on this slide that we do expect you to know all of these vessels and the structures that are listed here. So, and we'll get on to the aorta in a minute, but definitely for the pulmonary circulation, you need to know that the superior vena cava and the inferior vena cava return that deoxygenated blood to the right side of the heart, to the right atrium. That deoxygenated blood flows then into the right ventricle, up through the pulmonary trunk, which then branches into the left and right pulmonary arteries. They go off to the lungs, and then they continuously branch, and eventually, you end up with those capillary beds then that surround those alveolar sacs and those little alveoli. And that's where that gas exchange occurs. And then, of course, that oxygenated blood then comes back to the left side of the heart via the right and left pulmonary veins, 2 of each leaving each lung. This slide is just showing you this extensive capillary network that envelops the alveoli. So there's literally stacks and stacks of these capillaries that kind of wrap around the alveolar sac like a basket kind of, or, you know, like, I don't know if you ever remember those nets that kind of hold loads of marbles. I'm probably showing my age here. But of course, you know, this is the site of gas exchange with the air in the alveoli. When we get to the respiratory system, we're going to talk about the structure of these alveoli in way more detail. And we'll talk about the cells of the respiratory membrane across which, you know, you get that exchange of carbon dioxide and oxygen between the air in the alveoli and the blood in the pulmonary capillaries. So that's all we're going to say about the pulmonary circulation. We're now going to move on to the systemic circulation, and we're going to start with systemic arteries. Now this slide just gives you an overview of the systemic arteries, and I think that everybody will acknowledge that there's a lot, right? And we're not going to go through all of them. I'm just going to point out some important ones or major ones that we'd like you to be able to identify and name. So remember that the systemic arteries supply the body organs with oxygen and nutrients. We'll just go through this term anastomosis here because it is important to know a little bit about it. So the main arteries, as you move away from the heart, start branch, and they form smaller arteries which continue to branch to form arterioles and eventually those capillaries, right? You can have an arterial anastomosis, which involves arteries that open into other branches of the same or other arteries. And arterial anastomoses do increase as the distance from the heart increases. You could also have an arteriovenous anastomosis, which is what you're looking at here, and this acts as a shunt, right? And it, you know, occurs when blood flows from an artery directly into, or an arteriole directly into a small vein, and therefore bypassing the capillary bed altogether. So it acts as a shunt, and the one that we talked about in the previous part of this topic was in terms of thermoregulation, where, you know, when you're cold, that capillary bed doesn't open up, and you can get that movement then of that blood from that arteriole straight through into that small vein and totally bypassing that capillary bed. All right, so moving on now to the major aortic branches. And remember that, you know, all systemic arteries in the body are either directly or indirectly derived from the aorta. The aorta is the largest systemic artery in the body, leaving the left ventricle. The aorta then is divided into three general parts. We have the ascending aorta, we have the aortic arch, and then the descending aorta. And the descending aorta then is the longest part of the aorta, and it's further subdivided into the thoracic aorta, which you can see here, which is that part of the aorta that's above that sheet of skeletal muscle called the diaphragm. And then we have the abdominal aorta, which is the part of the aorta that's below the diaphragm. Okay, so let's go back here to the ascending aorta, which you can see here. And the ascending aorta just has two branches from it. And these are the right and left coronary arteries, as you can see here, that supply the heart wall with oxygenated blood. Okay, moving up then to the aortic arch, and you can see that there are three branches of the aortic arch. We have the brachiocephalic artery, we have the left common carotid artery, and the left subclavian artery. And these arteries are supplying the head and the upper limbs with oxygenated blood. You can see here that the brachiocephalic is sort of fairly short before it sort of branches then into the right common carotid, which supplies the right side of the heart, and then the right subclavian artery there supplying the right shoulder and the upper limb. The left common carotid then supplies the left side of the head, and the left subclavian artery supplies the shoulder and the upper limb. Now, everybody, it is really important that you do know and you can identify and name these arteries. And that's why we've put, a little rectangle around all of the ones that we want you to know about. So the thoracic aorta is located in the thorax, as you would imagine, and it has several branches that supply various structures between the aortic arch and the diaphragm. And then the abdominal aorta, which you can see it's indicating it's down this way, is part of the descending aorta between the diaphragm and that point at which the aorta ends when it divides into the two common iliac arteries. And again, it has several branches that supply the abdominal wall and also the abdominal organs. Moving on then to the head and neck arteries, you can see here the right common carotid, but of course there is a left common carotid as well. And they extend for a bit, superiorly without branching. And then each common carotid branches into the internal carotid and the external carotid. At this bifurcation here of the common carotid and the internal carotid is the carotid sinus. And the carotid sinus is really important in monitoring blood pressure. And you might remember me talking about it when I was talking about the baroreceptor reflex. Okay, there are then, several branches then of the external carotid that supply oxygenated blood to the neck and the face. And the internal carotid, along with the vertebral artery, which is formed from branches of the subclavian arteries, then supply oxygenated blood to the brain. And you can see here, the external carotid, its terminal branch then is the superficial temporal artery, and the external sort of carotid, sort of supplying most external head structures, as I mentioned that. So moving on to have a bit of a closer look at the arterial blood flow to the brain. Now we have you can see here these paired vertebral arteries. Well, they combine to form the basilar artery on the pons. And this basilar artery here runs superiorly up, sort of it's kind of dividing the sort of two hemispheres, and it's a big artery. Then we get the cerebral arterial circle, formerly known as the circle of Willis, on the base of the brain, which is formed from anastomosis of the basilar and also the internal carotids. And so you can see here the anterior communicating, anterior cerebral, posterior communicating, and posterior cerebral, all forming that cerebral arterial circle. Remember, everybody, that we just expect you to know the ones that are highlighted in red there. So the cerebral arterial circle supplies blood to the brain and surrounding structures. We say that it creates redundancy. What does that mean? It means that if one part becomes blocked or narrowed, just remember that word stenosis, meaning narrowed, blood can flow through other regions and ensure the brain remains perfused with blood. And most spontaneous strokes, not caused by trauma, are due to these cerebral arterial circle aneurysms. And an aneurysm is a weakened part of a vessel that gets kind of stretched over time. So it kind of swells and then it becomes so weak that it might bleed or even burst. Now, many of you will learn lots more about strokes as you go through your courses. But a stroke is a sudden neurologic disorder. It's often caused by a decreased blood supply to a particular part of the brain. It can occur as a result of a thrombosis, so a clot, which interrupts blood flow, or an embolism, which is like a floating clot, which eventually gets lodged in smaller vessels, or it might be a result of a hemorrhage or a rupture kind of a vessel, and therefore leaking of that blood from that vessel. Regardless, though, what the cause is, any one of these will result in a lack of blood flow to a particular part of the brain. And as a result of that, if there isn't sort of medical intervention, the tissue supplied by that artery will eventually die. It becomes necrotic, and of course that can be fatal for many people. And even if they do recover from the stroke, there can be specific neurological sort of results from that stroke. Okay, so now moving on to the upper limb arteries, and we're looking at the right side here. So there are three major arteries of the upper limb, and these are the right and left subclavian, which gives way then to the axillary artery. And then we have the brachial artery, which is an extension of the axillary artery. The subclavian passes between the clavicle and the first rib, so it's located deep to the clavicle, and that's where it gets its name from. The axillary artery is located in the axilla, and the brachial artery then is located in the arm itself. At the elbow then, the brachial artery bifurcates to form the radial artery and the ulnar artery. Many of you will know that the brachial artery is used for blood pressure measurement, and the radial artery then for pulse measurement. Now, the radial artery is the most common artery that is used for pulse measurement, but there are lots of places where you can take a pulse. The temporal artery can be used, and the common carotid artery can be used, also the brachial artery. And when we get to the lower limb, I'll point out the femoral artery, the popliteal artery, the posterior tibia artery, and also the dorsalis pedis, which can also be used. Now, for all of you that are really keen on all of this anatomical stuff, you can follow this figure here, which shows you sort of all the branches of the different arteries to the upper limb. So if you start here with your aortic arch and the three branches there being the brachiocephalic, the left common carotid, and the left subclavian, you can just trace, in your own time where all of these arteries branch again and where they eventually end. Moving on now to the arteries of the thoracic and abdominal regions. Here you can see the part of the aorta, that's the thoracic aorta, and there's branches then of the thoracic aorta that supply the thoracic wall, and also branches then that supply the thoracic organs. Then the aorta passes through the diaphragm and becomes the abdominal aorta, and there are three sort of major unpaired branches, and these include the celiac trunk, and we also have the superior mesenteric artery and also the inferior mesenteric artery, and we'll get onto those now in a second. So branches of the celiac trunk include the left gastric, the splenic artery, and the common hepatic artery, and they're all sort of supplying abdominal sort of organs such as the stomach, the spleen, the pancreas, the liver, and the duodenum. We also have branches of the superior mesenteric artery supplying blood to the pancreas, the small intestine, the appendix, and the first 2/3 of the large intestine, and then the inferior mesenteric artery, which is supplying blood to the last third of the large intestine. We also have the paired arteries, so the renal arteries that supply the right and left kidneys, and we also have the paired two common iliac arteries. Finally, now to the lower limb arteries. Remember that the aorta ends at the two common iliac arteries. These divide, so we get the external iliac artery, which then becomes the femoral artery in the thigh, which then becomes the popliteal artery, and that then becomes the anterior tibial artery, which then sort of gives way to the posterior tibial artery, which then continues as the fibula. But we will we'll leave it just there at the posterior tibial. So again, I guess just remember that the artery here that we're talking about is being named after the regions of the leg that it's passing through. For example, the deep femoral artery is supplying all of the thigh. And again, you can have a look at this in your own time, but you don't need to memorize it all. But here we're just going from the external iliac and looking at all of sort of the branches that branch off, say from the femoral there to the descending genicular, which supplies the knee joint to the skin of the leg, and so on and so forth, right down there to the blood supply to the foot. Okay, so I have finished on the systemic arteries. When I come back, I'm going to be talking about the major systemic veins.